bit to the side of the egg. One of the
Okay.
things that we really talked about that people have always discussed is egg preservation. What are the concerns that people have around egg preservation? Is it the way it's been stored? Is it the cost? Is it the fact that the baby that's going to come from egg preservation is not going to be as normal as the way it's supposed to be? Are there any concerns from the result from egg preservation after fertilization?
Not at all. I mean, um, egg preservation, as they call it, preservation of fertility. Um, Sometimes it could be, for instance, we have some patients or some clients, right? They might not be patients. They've not found Mr. Right, okay, and they think they are getting older, right? And the biological clock is ticking. So rather than just let it go to waste, some of them actually get cancelled. Some of them it could be as a result of their own personal researches or recommendation by their OBGYN to go freeze their eggs, right? So we still recommend that if you must do that, it should still be under age 35. But if you're freezing eggs above age 35, chances are that you have quality eggs is slim. Okay, so under age 35, you're not ready. Some people genuinely don't want to give birth yet because they just want to take time to focus on their career. They want to delay procreation, right? So when they are okay and settled and not distracted, right? So people like that, we encourage them to go freeze their eggs at an early age, right? But some people, if they think, oh, I'm almost going to hit menopause very soon, there's a lot of people who freeze their eggs at age 40, right? A little bit above 40. I'm going to work on a case upcoming. I think, the patient is a little above 40 at the time of freeze. So, but then the limitation with that is even when we raise embryos, we recommend that they do that genetic testing again because with increase in age, there are chances that the egg quality also, diminishes or declines. So, and it's also a game of numbers, right? So, if you want to freeze your eggs, the more number of eggs you have frozen, the better your chances. Because sometimes when we freeze the eggs and we try to thaw them, thawing them means that we want to bring them, warm them up back to room temperature and make them viable again. Sometimes some of them die. All right. Of course, there are thawing protocols that says that the procedure is very efficient and we can have up to 90% survivability rate. Right? That if you freeze 10 eggs, at least 9 of those 10 eggs will survive. All right, so that's a good mark of efficiency for that clinic. And sometimes, things can just go south. Half of the eggs could just die. All right, or even if they survive, maybe at the time of injecting them, some will still die. And so at the end of the day, irrespective of the number of eggs you freeze, all right, and as some egg bank models work, for instance, some people actually buy eggs from the egg bank if maybe they have hit that stage of menopause where they don't have any more egg production going on, right? Like those advanced aged couples we have, maybe the ladies like 40 plus, there's no more egg production, or maybe they've hit menopause and they need to use donor eggs. Some can buy donor eggs from the egg bank, and some egg banks sell their donor eggs. They sell it in cases of I think six, right? Six donor eggs. I've seen prices of that as high as 15, $16,000. You can imagine, yeah, 6 cases of eggs. So it's very expensive. It's precious gold. So yeah, so some people and some egg donors will guarantee, they'll give a mark of guarantee that okay, for every 6 eggs you buy from our egg bank, we guarantee that you're going to have at least one viable blastocyst. A
Mm,
blastocyst is the embryo that has grown to a stage of um, where there's enough cells and it has blossomed and it's good, and the potential of that making a pregnancy is higher. than all the cleavage state embryos that have not attained a blastocyst stage. So they will say that we guarantee that at least you get a blast from 6 cases of eggs that you buy from us. All right. The chances of a blast being transferred, getting you pregnant, at some clinics it could be as high as 60%. All right. That if you transfer one embryo, the chance that you get pregnant with that one embryo, 60% of the time. Some it could be as high as 70%. Some it could be as low as 40%, depending on the age as well, right, of the egg, right? So, but for a young egg, I mean, at least you should get the gold standard statistics averagely at 60% or 70%, all right? But if you're using your own egg at an advanced age, depending on the age, the chances of pregnancy begin to decline. For instance, if you're 40 and above, the chance of pregnancy is about 20% at that age if you had
Hmm.
used your egg. Right? If you're 37 to 38, maybe it's about 40%. 35 and below, then maybe it's at that 60%. So it all also matters depending on the age of the egg that's being used. But we recommend the more eggs you can freeze, the better for you. And at some advanced stages, like we had a case whereby the lady was, I think, 38, 39. She was trying to freeze her eggs at that age. And each time we do a retrieval on her, we don't get more than 3, 4 eggs, all right, per time. So out of those 3, 4 eggs, maybe she would have 2 that are mature because it's not all the eggs that are produced that are mature. Some eggs still have to be thrown out because they are immature eggs and they can do nothing, except if you consider doing in vitro maturation on them, which is not very effective still. Right. So this lady that was 38, 39 years old trying to freeze her eggs, we getting about 3, 4 eggs from each retriever. Right. We had to walk her up to having frozen the last can maybe like 14, 16 eggs now. But she had to do that over 3 to 4 retrieval cycles. So maybe if she does a retriever this month, she comes another month or 2 months time for her body to recuperate, does another retrieval, they get another number of eggs. You freeze that again. She comes another 2 months later, gets additional eggs frozen. Right. So up until the stage where she's comfortable with number of eggs. Yeah. So 20 eggs, for instance, we'll say, all right, at
Chances that you get viable.
20 eggs, you might get like 4. All right. So from those 4 blastocysts, the one that will actually give you a baby would probably be 2 of those 4, or maybe even 1 of those 4. Or sometimes, unfortunately, even none of those 4 at all. So it's also comes with a game of chance. With increasing age, advanced maternal age, such couples may need to go at it at several cycles before they get an adequate number of eggs frozen. Some just go or don't want to go through the stress, just go buy eggs from the bank. But then you have to understand that you're getting a baby that's not your genetics. But if you are able to handle the fact that maybe you're just adopting a child that you're actually giving birth to by yourself, then that's understandable. All right. So that's the way it works. All right. I hope I
Wow.
answered the question.
Yeah.